Hi everyone, Dr. Arthur Plesa here, founder of Knee Chest Specific Chiropractic Certification Seminars. Today, we are going to learn about the future of chiropractic as we take a look back into the history of chiropractic instrumentation. In the early years of subluxation analysis, chiropractors were limited to spinal palpation. They used this method to feel for deviations of the spinous process, believing that any twisting from center indicated a subluxation. Using palpation analysis, it was commonplace to adjust numerous segments, which got some results in getting sick people well. However, the limitation with palpation was that it could only verify the misalignment element of a subluxation. The chiropractor was in the dark about how much occlusion occurred and if it was sufficient enough to cause pressure and interference. The first breakthrough in objective analysis for subluxation happened in 1910, when B.J. Palmer became the first chiropractor to take an X-ray of the human spine. It was then introduced into the chiropractic profession as a standard of care. X-ray allowed chiropractors the ability to see the spine. This would replace the subjectivity of palpation with the objectivity of X-ray analysis. In turn, this also reduced the number of segments previously thought to be subluxated, which led to fewer adjustments and better results at getting sick people well. However, X-ray did have its limitations, as it only measured the misalignment and occlusion elements of a subluxation. In 1923, the Palmer School of Chiropractic asked the question, how can a chiropractor measure the pressure and interference elements of a subluxation? Since palpation cannot feel it, nor can an X-ray see it, a new device needed to be developed in order to measure the neurological aspects of a subluxation. In 1924, the Palmer School of Chiropractic introduced the Neurocalometer. This instrument was like a thermometer for the spine. It measured paraspinal temperature using a thermocouple sensor. The principle is that a subluxation causes heat to emit from the affected spinal nerve. Since the spine is symmetrical, pressure and interference to one spinal nerve causes a temperature differential at that segment. Finally, chiropractors could objectively measure all the elements of a subluxation, structural and now neurological. In 1936, chiropractic instrumentation marked its next development with the invention of the Neurocalograph by the Palmer School of Chiropractic. This device graphed on paper the heat readings from the neurocalometer in the form of a wave pattern, similar in appearance to an EKG. The neurocalograph improved upon instrumentation in two ways. First, it overcame the variable of human error. Since the neurocalometer was so sensitive, the human eye could not accurately see the details of each heat break reading, as the needle indicator quickly deflected from one side. Second, by graphing the heat line, B.J. Palmer began to notice a heat pattern being present when the patient had a subluxation present. The heat pattern tended to remain constant, only varying in intensity. This paved the way for pattern analysis, the gold standard of subluxation analysis used by knee chest upper cervical chiropractors. The Electroencephaloneuromentimpograph was the instrument which B.J. Palmer believed was the future of chiropractic. It was an electroencephalograph machine that was further developed to measure the amount of electrical energy transmission from the brain, down the spine, out through the IVF, and to any body part. This instrument confirmed three factors. First, the chiropractic adjustment is the only thing which restores normal quantity nerve flow. This is what gets sick people well. Second, it proved that the only place a subluxation could exist was at either atlas or axis. Third, after testing all chiropractic techniques, this instrument proved which were the most efficient at adjusting a subluxation and keeping it in alignment for the longest period of time. Those were knee-chest solid headpiece, side posture solid headpiece, and side posture drop headpiece are the most efficient according to objective instrumentation.